Welcome to a presentation of the National Mass Violence Center's SNAPS webinar series. We're grateful to the U.S. Department of Justice Office for Victims of Crime for its cooperative agreement that supports our center's programs and services. The opinions, findings, and conclusions or recommendations expressed in this webinar are those of the National Mass Violence Center and do not necessarily represent the official position or policies of the U.S. Department of Justice. In this SNAPS, we'll learn about the process of connecting your community to peer support as a form of wellness and healing after a mass violence event. I'm Dr. Trina Clayu, CEO of GivenHour. In partnership with the Mass Violence Center, we developed a peer support guide to help organizations and institutions learn the fundamentals for creating this type of community-based support for mass violence victims and survivors. Today, we will continue a SNAP series that will walk you through the resources and break down the fundamental components of community-informed, sustainable response to well-being. By the end of this session, participants will be able to, 1, determine how to assess and validate the need for peer support within their community. 2, identify key considerations and decision points in developing a peer support model. When creating a community-based intervention after a mass violence tragedy, it's important to focus on the voices of those directly impacted to identify their needs and how they want to receive support. Every community is different, so while it may be tempting to copy successful programs from other places that have experienced mass violence, it's essential to consider unique factors. These include which populations are most effective, what resources are available, and past experiences of giving and receiving support. Listening to a wide range of community members helps ensure that new programs are both accepted and effective. Integrating this process into the development of peer support model ensures that organizations can effectively address community needs while gaining insight into how peer support will be received and utilized. Community needs assessments provide a deeper understanding of the population and their challenges, foster greater engagement, enhance resource allocation, improve program planning and evaluation, and increase funding opportunities. The use of multiple methods to gather community input is a multifaceted approach that can yield more comprehensive data and deeper insights. By following these steps, organizations can gain valuable input from those who would benefit from peer support, determine if the community would be interested, and ensure that peer support programs are both relevant and impactful. Ideally, to hear directly from the community, start with understanding the existing data, such as demographic data from the latest consensus, data.gov, county and city economic snapshots, county rankings and roadmaps, or other reliable resources. Take time to look at the community through various lenses, including social economics, life circumstances, disability, education, access to technology, and population density. This will help you determine the most effective methods for engaging different subsets of the community. Surveys are a commonly used method for quickly gathering information within a community, especially when they are digitally distributed. They offer several advantages, such as automating questions based on previous responses and enabling more targeted data collection. However, surveys can sometimes feel impersonal, and so there's no guarantee that participants will complete them or provide candid feedback. Another way to assess interest in peer support is to incorporate these questions into broader surveys that are often distributed by resiliency centers in the aftermath of MVIs. While surveys are valuable tools, they are most effective when kept brief and used alongside other methods to gather community input. Listening sessions with small groups from different community subsets can be more time-consuming, but they help foster connection, build trust, and encourage honest feedback. These sessions also promote greater investment in the peer support program. Holding them as a series provides multiple opportunities for participation with flexible options for different days, times, and formats, virtual or in person. It is essential to consider language and accessibility needs, have a skilled facilitator to guide discussions, and ensure sufficient staff to accurately document and summarize key insights. For more detailed guidelines around community input, see A Guide to Developing Peer Support Programs After Mass Violence Incidents. If you do determine there is both a need for more mental health supports in your community and an interest to explore peer support as a non-clinical option, you have several operational decisions to make. First, you will need to determine who can join your peer support program. If you are running virtual or in-person groups, will meetings be open, drop-in, or closed to committed members meeting certain conditions? What criteria do peers need to meet in one-on-one or group settings, and what will be your structured screening process to protect the integrity and safety of everyone involved? Next, consider how often people need access to peer support and your organization's capacity to help facilitate points of contact and the duration of these engagements. Other considerations do include, would your peer support program function best in person, online, or with a hybrid approach? Is there an ideal size, for example, small, more intimate groups or larger, widespread communities? In addition, it is helpful to determine the usefulness or even necessity of retaining licensed professionals to intervene during crisis situations. To help your community better understand the benefits of peer support, your organization could host informational trainings and webinars open to the public. You can also find opportunities to access these resources at givenhour.org. These sessions can be used to introduce the concepts and behaviors that are foundational in peer support, including how to set boundaries, active listening, and what to expect from a peer support relationship. As individuals identify that they are interested in peer support, your organization now has the role of connecting the right people to the right resources. This is where your operations planning will help determining who and how individuals get connected to your program. In group settings, it's important to identify a facilitator who, ideally, has similar lived experience as the peers in the group. Facilitators should be empathetic, good listeners, and capable of guiding discussions. They can be professionals or volunteers far enough into their healing journey to meet the role demands. Facilitators be provided an in-depth and standardized training covering trauma-informed group dynamics, communication, conflict resolution, and crisis management. givenhour.org is also available to assist in these types of engagements. We know that learning is ongoing, as is the need for check-ins and moments of reflection. It's also important to provide additional training opportunities to facilitators as well as access to trauma-informed resources. When designing a peer support program, it's important to consider factors such as legal implications, staffing, and costs. Key questions for decision makers include, do we pay our peer supporters? This depends upon your budget and how compensation might influence peer supporters' approach to the work. Are we liable for volunteer peer supporters? Review your insurance policies and consult with legal counsel to clearly define liabilities and mitigate risk. Do we have the staff to manage this program? Whether offering one-to-one, group, ongoing, or intermittent support, the program requires dedicated management. Depending on scale, this could range from a part-time to a full-time position. It is highly recommended that this role is not filled by a volunteer. Details on roles and responsibilities can be found at A Guide to Developing Peer Support Programs After Mass Violence Incidents. Effective peer support requires fostering an environment where all survivors feel valued, accepted, and understood. Socially responsive care means recognizing, respecting, and appropriately responding to survivors' different and unique experiences. Creating a welcoming space is an ongoing process that demands continuous learning and adaptation to meet the evolving needs of communities. By prioritizing local concerns and a sense of belonging, organizations can create peer support programs that truly meet the needs of all survivors, fostering healing in ways that honor their unique experiences. Many people in the U.S. speak languages other than English, with Spanish being the most common. Depending on the region, organizations may need to provide materials and services in Spanish, as well as in other languages spoken by Indigenous and Asian communities. Beyond translation, it's important to recognize how words like resilience, home, trauma, help, and others carry different meanings across populations. Learning and using language that resonates with different communities fosters trust and engagement. People have different ways of honoring loved ones and processing grief. Some communities may find comfort in public gatherings and advocacy, while others prefer private rituals. Understanding and respecting these different approaches help create spaces where people feel safe, expressing their grief and healing in ways that align with their beliefs. Belonging goes beyond outreach. It should be reflected in leadership and decision-making. Survivors and community members from all backgrounds should have a voice in shaping peer support programs. Organizations should actively engage individuals from all affected communities and provide them with meaningful roles in program development and implementation. By prioritizing local concerns and a sense of belonging, organizations can create peer support programs that truly meet the needs of survivors, fostering healing in ways that honor their unique experiences. Let's check back in on this SNAP's learning objectives. Number 1 was to explain how to assess and validate the needs for peer support within the community, recognizing that peer support is most effective when communities understand its benefits and are willing to engage. And 2, identify key considerations and decision points in developing a peer support model, including defining the target population and preparing the organization in order to ensure the model is created as a healthy and effective resource for those served. Did we identify how to assess and validate the needs for peer support in your community? Did we help you identify key considerations and decision points when determining the peer support model that would best meet the needs of your community? Please let us know if our learning objectives were met by taking a photo of the QR code on this slide, which will take you to a brief, anonymous survey to assess this SNAPS webinar. You can also provide us with suggestions for additional SNAPS webinars, which we always appreciate. Thank you so much for completing this survey. We appreciate your participation in this SNAPS webinar about guidelines and protocols for creating peer support programs.